So we have a great turnout in person, but also a lot of people online as well. So let's say that for those who just joined us, I want to welcome you to the annual meeting of National Academy of Medicine. So every October, we bring all of you together, and the council, with your advice, select a theme. And today's program, Bridging Science, Practice, and Policy to Advance Mental Health, is really a timely, important topic. And we have a fantastic lineup of speakers and panelists who discuss social drivers, emerging science innovations, economic and policy considerations, all, of course, looking at equitable mental health and mental health care. So I'm just really looking forward to today's meeting. And I do want to thank the program committee to begin with, and of course, Huda Zoghbi, who chairs the committee. She has just been outstanding as a leader, and of course, thought leader, thinker, and organizer. She's joined by Jose Escasey, Eva Feldman, Mae Jameson, Quick Simon, and with expert support of Kav Ziraza, Yasmin Hurd, Cheryl King, John Christo, and Peter Sterling. And of course, let's not forget our staff, Aisha Salmon and Se Kim and Miso Park. Please join me in thanking them to begin with. On the website, you'll find today's program, speaker bios, disclosure statements, information about planning committee, and other relevant background. I encourage you to take a look. Also, the meeting's being live tweeted on X using hashtag NAM meeting, spelled MTG meeting, and please join the conversation. So now, I think it's my great pleasure and honor to ask Huda Zoghbi to come up. Huda, as you know, is the Distinguished Service Professor at Baylor College of Medicine, Director of the Neurologic Research Institute at Texas Children's Hospital, investigator of Howard Hughes, and I can go on, but she is just outstanding. Huda, please.
Thank you, Victor. Good morning, and welcome to those of you here in the auditorium and online. The topic of this year's program was conceived after the Council considered the most pressing medical problems that need multidisciplinary engagement going beyond the traditional physician or scientist. With about 1 in 5 adults experiencing mental illness annually and 17% of youth experiencing a mental disorder, the data clearly show that mental illness is the leading cause of disability in the USA, with an economic burden of about $225 billion annually. Mental disorders are quite complex in that they are influenced by many factors, and the cause is rarely one thing. While genetic factors might render some individuals susceptible to mental disorders, environmental and social and economic factors play a big role. For me personally, the experience I've had in Houston at our hospital was truly illuminating and underscored the urgent need to think about this problem. So I thought a couple of pictures are worth 1,000 words. You see here emergency room visits to Texas Children's Hospital, which is the largest hospital in the nation. And I thought showing such data is helpful because Houston is one of the most diverse cities in the USA, and we don't have a county hospital, so the hospital sees all comers from all classes and backgrounds. And you'll see in January 2020, the rate of visits to the emergency room, about 80 per month. And you'll notice blue, the bottom blue is suicide, orange is self-destruction or harm, gray aggression, yellow elopement, and then other. And you'll notice March 2020, when the COVID pandemic and lockdowns began, you notice the rise in the visits, particularly suicide. And what's really alarming is then after schools open, this rate did not go down. So if we look now per year, if you see the numbers per year, about 800 visits to the emergency room per year. In 2020, that number went to 2,000, 2021 close to 4,000, and now the data for 2023 over close to 5,000, with 4,000 of these suicide, requiring a sitter, requiring someone to watch these children. So this clearly shows us that there are external factors, environmental, social, and other. And I'm sure you agree with me that such data, together with the fact that only 40 to 45% of adults with mental disorders receive treatment, and that health disparities are higher among underrepresented and low-income population. And of course, stigma continues to be a deterrent for seeking help. All these together underscore the need for interventions on many levels. As depressing as these facts might be, they actually highlight opportunities. It is much harder to reverse a disorder that's purely genetic. In contrast, we can address many external factors through a variety of approaches, from heightened awareness, education, to ensure access to therapy and support for all. So it was these considerations that inspired the program committee that you just showed their names for us to come up with today's meeting, which, as you've heard, has 3 panels. The first one will address the key social drivers affecting mental health and substance use, and this will help us understand what these factors are. The second panel, emerging science and innovations for therapies, highlighting scientific advances from a broad and multi-different disciplines. And this will chart the path for new therapy. And the first panel will focus on the important topic: how do we get these therapies to everyone who need them? We have allowed ample time for questions from both you in the room and online. And before we kick off the meeting, I'd like to thank, in addition to the committee member, all the people who've helped me make this possible. Victor, thank you for always being available to hear about potential speakers, helping us recruit the best of the best. Very grateful to that. And Say Kim, Jessica Marks, Sarah Hetzig, and Aisha Salman, and even today, great help from Sunita Krishnas. Thanks all of you for helping me make this a great program.